cardiac arrest emergency can happen anywhere and at any time. In the United States, there are about 300,000 cardiac arrests each year. More than a third of the patients who do arrest do so while in a hospital setting. As healthcare professionals, it is our duty to respond to such emergencies with the knowledge and skills necessary to save lives. Hello. This training video has been created to review the basic life support steps in both an inpatient and outpatient setting. In the next few minutes, we will review an important change in the American Heart Association's 2010 guidelines, the importance of early defibrillation, some basic code card equipment, the components of high-quality CPR, and the steps of the BLS algorithm. Under the American Heart Association 2010 guidelines, the old well-known ABC method has been changed to CAB, with chest compressions now taking priority over opening the airway and providing rescue breaths. The old method often caused a delay in chest compressions, which is critical to a patient's return to spontaneous circulation. The 2010 guidelines recognize that there is approximately 8 to 10 minutes of reserve oxygen left in a patient's blood and lungs from the last breath. First responders can now take advantage of that reserve oxygen by starting with chest compressions. Since ventricular fibrillation, or VFib, is the most common cause of sudden cardiac death, defibrillation or shocking the patient is often warranted. If defibrillation is provided within 1 minute of the start of VFib, it is 98% effective. However, each minute defibrillation is delayed, the patient's chance of survival decreases by 7 to 10%. Therefore, it is important for hospital personnel to not only be trained in BLS, but also review those skills periodically to maintain proficiency. Every unit has at least one AED and code card assigned to them. You should know or find out where your AED and code card are located. If you are away from your unit and need a code card, look for the overhead placard to help locate the nearest AED and code card. Every code card is equipped with an AED, or Automated External Defibrillator. When the front panel of the AED is closed, it is in AED mode. The 3 main buttons that are visible are color-coded, numbered, and labeled for easy use. If you open the front panel, it takes it out of the AED mode and puts it into ACLS mode. The AED mode will allow the device to provide assistive command prompts. First responders who are not ACLS certified or who are not familiar with this AED should only use it in the AED mode. In order for the AED to deliver a potential life-saving shock, it needs to be connected to defibrillation pads. Each code card is required to have 2 sets of both adult and pediatric defibrillation pads. In the event of a cardiac emergency and an AED is required, it will arrive on a code card already connected to a set of adult defibrillation pads. To correctly apply those pads, simply follow the illustrations on the back of each pad. Now let's review what it means to have high-quality CPR. But first, keep in mind you may need to reposition the patient to a hard, flat surface before initiating CPR. High-quality CPR includes a rate of at least 100 compressions per minute, a compression depth of at least 2 inches for an adult, allow the chest to completely recoil after each compression, minimize interruptions in chest compressions, and avoid excessive ventilation. Now let's review the BLS algorithm and the steps for initiating an emergency response. Keep in mind that a copy of the BLS algorithm can be found in the code card binder. Step 1. Check for responsiveness. Tap and shout, "Are you all right?" and then scan the chest for movement.
Sir, can you hear me?
Step 2. Activate the emergency response system and get the AED and code card. Remember to shout for help and direct someone to call 911 and get the AED and code card.
Can I get some help over here?
What's
You,
going on?
call 911. You, get the AED.
Okay.
If in an inpatient setting, shout for help and press the code blue button. Then direct someone to get the code card and to call the ER at 376-2020.
Mr. Johnson, Mr. Johnson, I need help. He's unresponsive. I need the crash cart and I need you to call ER.
Okay.
Step 3. Circulation. Check the carotid pulse for no more than 10 seconds. If you find a pulse, support the patient with rescue breaths. Give one breath every 5 to 6 seconds, reassessing every 2 minutes. If you cannot find a pulse within 10 seconds, immediately begin CPR. Give 30 chest compressions followed by 2 rescue breaths. Continue CPR until the AED and code card arrive.
$28, $29, $30.
Step 4. Defibrillation. As soon as the AED and code card arrive, immediately turn on the AED and apply the pads. Continue CPR until the AED is ready to analyze the heart rhythm, and then provide a shock if advised. Prior to a shock, ensure that everyone is clear of the patient.
Stand clear, analyzing rhythm. Shock advised, stand clear. I'm clear, you're clear, we're all clear. Shocking.
Step 5. Resume CPR. Following the shock, or if shock is not advised, immediately resume CPR. Recheck for a pulse and reanalyze the rhythm after every 5 cycles of CPR, each approximately 2 minutes. Remember to switch roles to ensure high-quality CPR is maintained.
Shock delivered, resume CPR.
Continue to follow the command prompts of the AED and follow the BLS algorithm until advanced healthcare providers or the code team arrive. Now that we've seen the steps of BLS broken up step by step, let's put it all together, but this time in an inpatient setting. Okay, here's the scenario. There's a 67-year-old male patient who was admitted overnight for a right hip fracture. Now the patient's scheduled to have surgery in the morning. The technician at 0100 comes in to do routine vitals, but finds the patient unresponsive and without a pulse. Let's watch.
Hey, what's going on, Mr. Johnson? Just here for a quick set of vital signs. Mr. Johnson? Can you hear me? Mr. Johnson? Hey, can I get some help in there? He's unresponsive and I can't get a pulse. Okay, you do call 911 and you get the code card.
Okay.
Attention in the hospital, attention in the hospital. Code blue,
4D, room 203. Code blue, 4D, room 203. Dr. Stat.
Slap compressions. Analyzing rhythm. Shock advised. Stand clear. I'm clear, you're clear, we're all clear. Shocking. Shock delivered. Continue compressions.
Alright guys, what do we got?
We have a 67-year-old male who came in today for a right hip replacement. He was found unresponsive. He has a history of hypertension, diabetes, and an allergy to penicillin.
30.
Let's take one final look at the BLS algorithm. Step 1. Check for responsiveness and for normal breathing. Step 2. Activate the emergency medical response system and get the AED and code card. Step 3. Circulation. Check the carotid pulse within 10 seconds. If no pulse is found, immediately begin CPR. Step 4. Defibrillation. When the AED and code card arrive, immediately attach the pads and analyze the rhythm. After the shock, or if no shock is advised, Step 5. Resume CPR. Witnessing a patient in cardiac arrest and being expected to render basic life-saving aid can be very stressful. But like with anything, with practice comes proficiency. I hope this training video has helped reinforce the components of BLS.